As AOF, we believe that all Ohioans should have the opportunity to participate in the economy, afford the basics, and pursue higher quality of life. Work should always allow workers to lift themselves out of poverty, but not all jobs mean a living. Health and Human Services can play a critical role in supporting Ohioans. So let's take a look at the future and the process that we're going through. We now have a Finance Committee, which is chaired by Representative Ryan Smith, and they have one Health and Human Services Subcommittee that is chaired by Representative Sprague. In the Senate, we have a Finance Committee and numerous numbers of subcommittees that have been working. But as of last week, the Senate passed their version of the budget bill. The House had previously done so, and each of the chambers appointed 3 members to the Budget Committee, and their first meeting occurred last Friday, where they heard from the LSC and from the Department of Budget and Management about their revised budget numbers, which in this case, they indicated, both of them, that there were significant increases in availability of revenue. I might remind everyone that under the Constitution, the 2-year budget must be passed by June the 30th, which is a week from next Wednesday. The only way in which the state can continue to operate, if that is not accomplished, is by additional daily or multiple day extensions of the current budget. But we're most optimistic that this is going to happen by June 30th, so we have a very, very tight timeline that we're involved with. The latest projections by the Director of Budget and Management shows that there are $340 million more money available than was originally stated. And the state can meet the needs of those in need of assistance and still save for the state's fiscal future if they choose to do so. I'd like to point out to you the members of the Finance Joint Conference Committee. First of all, the leadership in the Senate is the President Faber, who is from Salina, and you see his phone number for his office and his email address. The 3 members that were appointed by the Senate are 2 members of the majority party, Senator Oschlager, who is the current chair of the Senate Finance Committee, and Senator Coley, who is the vice chair of the Senate Finance Committee, and the minority leader of the minority members of the Finance Committee was also appointed Senator Skindell. In the House, you have the leadership in the new Speaker, Representative Rosenberger, and as I indicated before, the chair of the House Finance Committee is Representative Smith, and his vice chair is Representative Schuring, and the minority leader of the minority party in the House is Representative Driehaus. At this time, I'd like for Carl Owens, who is one of our co-chairs of the organization, to do a presentation on some subjects that we are working on to try to secure passage. Carl?
Well, thanks very much, Bill, and good afternoon to everyone who's listening and participating in this call. We're really pleased with your interest and trust that you'll take this information and make good use of it in the coming days while the conference committee is doing its work. I want to present very briefly 5 of the issues that AOF has been working on in the last several months that were agreed upon after a rather lengthy process among our membership. First of these is the so-called person-centered work programs. This was a priority of ours, also happened to be language that was utilized by the governor in his budget proposal. But the governor did propose an intensive case management program for 16 to 24-year-olds who are required to work by their receipt of various kinds of assistance, primarily Ohio Works First or our TANF program or food assistance. The House took that proposal out of the budget, but has introduced separate legislation, House Bill 196, which would reinstate the intensive case management program along with a counterpart program that would be separate from that and really outside the Human Services Administrative Network, the so-called Healthier Buckeye Council proposal. The Senate chose to reinstate the governor's proposal with various modifications and took out the separate Buckeye Council grant program that would have provided grant monies in different counties for services that would have been outside the governmental program network. We have supported the governor's approach and the Senate's approach and trust and hope that that will be adopted, but we'll monitor implementation closely. This approach does not knock out the Healthier Buckeye Council altogether, but does make it voluntary in the counties and not mandatory. Next, we have the work support programs. The governor's budget increased entry-level child care eligibility by 5%, from 125% of poverty to 130% of poverty. This is a very modest increase. As background, entry-level eligibility had been 200% back in 2010, but through the recession it took various hits and has been reduced substantially. Even at 130%, what that would mean is a woman who had a good job, say 175, 180% of poverty, but lost that job, could not come back into the system unless she took a substantially lesser paying job. Otherwise, she would be accountable for all of her child care expense herself, which is virtually impossible for people at that wage level to pay. AOF has sought an entry-level reinstatement to the 200% over a 4-year period. In other words, not to be done all at once, but with increments of about 20% or a little less each year for 4 years, with an additional $15 million per year of increase to cover those increments. We have a refundable state earned income tax credit right now in Ohio, but it is not refundable. We have a 10% earned income tax credit, that is 10% of the federal, that is not presently refundable. And a refundable credit is not included in any of the 3 versions of the budget. We are seeking a refundable credit at the current level, 10% of the federal, with the cap removed. This would allow the credit to act much more like the very successful federal credit and help many, many more working families in Ohio. Next, Adult Protective Services. The 2014-15 state budget included a whopping total of $500,000 or $500,000 for adult protective services for the entire state. In the division of that money, some counties got as little as $550 a year, which is obviously not enough to hire a staff person, and it's virtually not enough to buy paper and paper clips to run a program. The governor's budget proposed $3.5 million per year, $2.6 million for counties. Basically, that was calculated on the basis of making sure that each county got at least $30,000 times 88, and then using the balance for state administration, or the other $800,000 or so. This has been unchanged in the House and Senate versions of the budget. AOF's goal, which is shared by other senior advocacy groups, is $20 million a year, which would include the governor's 3.5, but would go much further to ensure that counties had adequate monies with which to meet the growing need for services. This is an arena of growing need. Reporting instances are much higher, and unfortunately many instances are not reported at all. But it's in our view vital that we have stronger services for this population. Next is the Children's Protective Services piece. Sadly, and this has been true for some time, Ohio is 50th in the country in state share of funding for children's protective services. And as I say, this has been true for a number of years. In more recent years, because of the recession and budget cuts, we have lost $53 million to Children's Protective Services since 2009, or the last 4 or 5 years. And in addition, and this is a particularly difficult pill to swallow, we stand to lose an additional $17 million in each of the next 2 fiscal years, 2016 and 2017, because of the working of the tangible personal property tax, which has caused certain counties to lose a lot of money. So the net result is a total loss of almost $90 million by the end of the next biennium. Both Public Children's Services Association of Ohio and Advocates for Ohio's Future are seeking an additional $20 million per year for Children's Protective Services, of which about almost $9 million would go to base funding for counties, $100,000 per county for 88 counties, and the balance would go to counties via formulas that would track various other strategic criteria, all of which would go to increased investment in permanency efforts in our counties. This is a vital area that really must be addressed, and we've been working very hard on trying to persuade legislators that they need to pay very serious attention to this area. And finally, for those issues that I'm going to cover before turning it over to Mark, the Ohio Housing Trust Fund. Trust fund has been in place for some years. Right now it has a statutory grant of $50 million that is granted to the trust fund for housing purposes. And the governor's budget, he created something called the Housing Trust Reserve Fund to capture the first additional $15 million in fees over the $50 million that is already statutorily granted to the Housing Trust Fund. And that was left unchanged by the House. The purpose of this was to bring a little more stability into a situation which tended to be volatile from year to year in terms of how many fees are paid into the recorders for these purposes, real estate purposes. The Senate has mandated that half of the amounts collected, that is the original 50, this is not about the reserve fund, but about the original 50, which now all go into the fund, that half of that money be taken back and given to county recorders locally, to be distributed locally. It does require that they focus on these populations of people: homeless, low-income people, people with disabilities, older people, and youth. But it does leave it up to local recorders to be able to set up and manage a distribution system, which most of them are not, if not all of them, are not set up to do. So Ohio, the Coalition on Housing and Homelessness in Ohio, and Advocates for Ohio's Future are mutually seeking to restore the previous system with all of the money going out at the state level, which would eliminate the inefficiency of having 88 different programs and all of the unnecessary administrative costs that would be incurred by doing so. So those are the first 5 issues that we have been engaged in and are encouraging others to become engaged in. And at this point, I'll turn it over to my colleague, Mark Davis.
Thanks, Cole. And again, I want to echo Bill and Becca and Cole's appreciation for everyone taking the time today to be on the call. As you know, and as Bill outlined, the budget process is a bit of a filtering process, and we have narrowed the scope of influence, people who influence the process, down to a very narrow list. So we've got members of conference committee and leadership, so perhaps 8 to in the governor's office, 9 to 10 folks really that have significant input into this process. So we appreciate you spending the time today to learn about what our issues are that we're following, that we still have concerns over, and then communicating that to those folks and to communicate it to them frequently. We appreciate that. I'm going to start off on Medicaid. First of all, Medicaid is, you've heard a lot about the about the amount of money that Ohio spends on health care and how we rank low in terms of health outcomes. The legislature has heard that, as the governor's office is trying to change it as well. And this, the Senate required information be given to just continue an annual report on the health care needs of low-income pregnant women, infants, and children, areas in which we have done particularly poorly. Also, the Senate replaced a House provision, and again, we're focusing on things that change in the Senate and things that we still think need some work. Replaced a House provision with a provision that requires the Department of Medicaid to establish a Medicaid waiver program that creates basically value-based purchasing modeled on HSAs, health savings accounts, uses premiums, co-payments, etc. I want to remind everybody that Medicaid is a health coverage program for the poor, which means that folks are struggling to meet their daily needs, let alone be able to access health care coverage if there were premiums or co-payments. We believe these are relatively affordable, but again are cautious. I want to express some caution that this is a health care program for the poor, so anytime we put on additional costs to them, we certainly are concerned about that. And this value-based idea, if you look at the fourth bullet down, it's by July 1st, 2020, at least 50% of the aggregate net payments by Medicaid are going to be value-based. So they're looking at over half, at least half, of what they pay for being in a value-based purchasing model over the next 5 years. So that's very, very aggressive pace, and we'll continue to watch that carefully. Children in foster care and children who have been adopted are back into managed care. They were in the executive budget, out in the House, back in the Senate. The elective enrollment of individuals with DD in managed care, so folks that are in the DD system for waivers or ICF services, can participate in the managed care if they choose to do that, but are not, as they are in foster care and in adoptive care, they're not required to do so. I've got a bit of a cold, so if I'm on mute for a second or two, I'm just coughing, so don't worry about it. Community health workers, managed care companies now are going to be organizations who work in Medicaid, are going to be required to have community health workers, and particularly focused on areas of high infant mortality. As you know, Ohio ranks near the bottom in terms of infant mortality in the United States. The hospital provider tax was put up to 4% by the House, and then reduced back to 2.66% in the Senate. This was touted as saving Medicaid dollars, when in fact what it does is it reduces the revenue available, because all the money that is saved is federal, $452 million in total, and $73 million of that was earmarked for health and human services outside of hospitals. Independent providers, that was a big issue in the House, a little less of one in the Senate, and what that is that issue will be studied by the legislature with an intent to resolve it by December 31st, 2015. Again, another aggressive timeline for an issue that's been somewhat controversial, although the path laid out by the Office of Health Transformation with input from stakeholders seems reasonable with a couple of holes. We're concerned about making the transition from a traditional HCBS waiver, passport, IO, level 1, et cetera, transitions, home care, to a self-directed component to be as seamless as possible for the folks receiving services and their caregivers. We're concerned that the rates will be the same paid to providers, that the services will stay the same for the people receiving those services, and that the certification or provider agreement requirements in self-direction will not deviate significantly from your traditional, from the services that they're in right now, so that independent providers, will not have any challenges in terms of continuing to provide that care if the person receiving the care wants them to continue in the self-directed environment. So we're going to continue to watch that very closely as well. And then Medicaid is required to report on clinical care and outcomes to the General Assembly on the Medicaid expansion population. So it is a particular focus only on the Medicaid expansion population, and we would hope that those clinical care and outcomes are important for the entire Medicaid population. In behavioral health care, basically behavioral health care went back into managed care, and with JMOC approval and oversight, it looks like it will be, in the Senate at least, it's deferred until January 1st, 2018, which saves some money in terms of implementation. And it requires JMOC, the Joint Medicaid Oversight Committee, to monitor the Department of Medicaid's actions about that inclusion of behavioral health care services in the managed care systems. And finally, the home health aid services for non-independent providers was increased 10% in the House, and then it was cut in half in the Senate, reduced to 5%. In developmental disabilities, the direct care increased funding was reduced $10.5 million, and they added a clause that said the funds had to be available for a 6% increase. We're very concerned about both of those. We know that there are anywhere between 47 to 62% turnover among direct care staff. They are often they're paid wages at or below poverty and struggle to make ends meet, oftentimes having to decide whether they're going to put food on the table or gas in their car. We also know that this is the number one job in demand, according to the U.S. Department of Labor. As the baby boomers age and as folks with disabilities, the prevalence of disabilities continues to rise, we know that the need for direct care workers will certainly not abate, and we are very concerned about supporting those folks to make sure those critical services are necessary. The rates for ambulance services were increased in the Senate by at least 10%, and we'll see how that if these will survive in the conference committee. At this point, I believe I'll turn it back over to Bill for food and nutrition.
Yes, in the food and nutrition area, we do have some good news, although we have some reservations as well. And that is that the House version added $2.5 million to the governor's proposal for a total of $17.25 million a year for our food program to help people who need food on the table in order to make it through the day every day. The Senate increased that to $19.75 million a year, but also shifted the bulk of the money over to the TANF fund, and we have concerns about whether or not that will be in a situation where we are then in a situation where we have to choose one need over another rather than having adequate funds all the way around. So we're going to be continuing to monitor that situation, but we are pleased that we have achieved through a variety of sources, although we have, as I said, some reservations and concerns, we have achieved the necessary funds that are estimated for this coming 2 years. So let's wrap this thing up and see where we are. If we could go back to the slide that we showed with the conference committee, I would like to give you a little bit of information, if I could, please. We have on the line right now 112 people that are listening either online with just a telephone or with our slides. All the slides will be available, and Rebecca will be telling you about that in just a little bit. But let me tell you one thing. There was a study done by Brown University in which they asked staff members of legislators and members of Congress, at what point do you highlight an issue and say to your boss, to that legislator, hey, we need to be monitoring this, we need to be watching this carefully, and we need to do something about the problem. It takes 5 phone calls to an individual legislator for that to occur. That was the results of that study. So with our 112 people on the phone lines right now and on the webinar right now, we can very easily get to the situation where we could have 5+ phone calls. In fact, it would be great if we could have 112 phone calls into each of those members of the leadership as well as the members of the Joint Conference Committee. I encourage you strongly to talk about this issue. I would add that this issue does not cause a serious reduction in what the state wanted to do in terms of increasing the monies and revenues available in case there is a downturn in revenue sources in the future. This money is there, and it would not impact significantly the amount of money that would be available for that need. So I encourage you strongly, speak about the issues you're comfortable speaking about, call the members of the Senate, call the members of the House, and let them know that we need some actions taken because time is short. A week from Wednesday is the 30th of June. A week from Tuesday, is the 30th of June. July 1 would be a week from Wednesday, and the new budget has to be in place.